Okay, so this presentation is on chapter 7 from your book about suicide. Okay, so suicide is actually one of the leading causes of death in the world, and we'll talk about the specific age groups that suicide impacts. In addition to talking about suicide, we need to also distinguish between people who attempt suicide versus people who are actually successful, or what we might call suicide completers. So it should come as no surprise to you that there are many more parasuicides or unsuccessful suicide attempts than there are actual suicide completions, at least within the United States. Suicide behavior disorder is added to the DSM. It's added in the back of the DSM because it's not currently a diagnosis, but it is considered to be a condition of interest, something that is considered to require further study. So in later editions of the DSM, after our current DSM-5, we might start to see that this is actually a diagnosis. So with the suicidal behavior disorder, typically, we also see some kind of comorbid psychological disorder, most typically depression, but it can be other psychological disorders as well. And the person has made a suicide attempt within the past 2 years or 24 months. Additionally, with the suicidal behavior disorder, oftentimes suicide becomes a repeated pattern. So it's not just one attempt, it's oftentimes multiple attempts. But again, it's not currently a diagnosis, but it's likely to be added to DSM next edition. So part of the kind of controversy that surrounds suicide could be potentially related to the ease of access of different ways to commit suicide and different ways that might actually glorify things that are related to suicide. So this depiction here shows some video footage that is easily accessible on the internet, where individuals are, kind of showcasing and glorifying self-mutilation. So self-mutilation, self-injury is basically, hurting yourself purposefully, and then in some cases posting these things online for people to see. So it's a pretty disturbing trend. And part of what makes it so disturbing is that typically young people, so think young children, adolescents, are the ones who are accessing these videos. And for these young children who are very impressionable, the risk is that this kind of normalizes this practice, right? Kind of makes it seem like, oh, this is totally normal, right? Like people do this. This is a normal behavior. In addition to that, it also kind of fosters a community that almost supports this behavior, right? An online community that, kind of deems this behavior acceptable or okay. And then additionally may lead to more destructive behaviors where the person is not seeking help. Okay, so those are some of the dangers that are associated with this particular practice online. All right, so let's look at some of those demographic factors that figure into suicide rates. So as you guys can see here, at least within the United States, we have pretty high percentages of white Americans and of American Indians or Native Americans, indigenous people, in terms of suicide. And if you look here at the comparison between men and women, very clearly that men are much more likely to actually commit suicide compared to women. So part of the reason for that is that although women are more likely to attempt suicide, okay, so they're more likely to actually try to commit suicide, they're less likely to be successful, right, or less likely to complete suicide compared to men. And part of the reason for that is that women often choose less fatal means of committing suicide. So men are more likely to choose violent methods like using a gun, hanging on themselves, stabbing. Women more likely to use less violent methods, so think a drug overdose or something like that. And in particular with suicides that use guns, we see a very high rate of completion, and men are more likely then to use that particular methodology. Okay, so in terms of suicide and age, then, this is an important finding, an important factor here, where we see that over the course of the lifespan, the older that the person gets, and you guys can see this peak here in this 45 to 64 age group, that generally speaking, as people get older, there is this increase in suicide. And many reasons exist for that. But if you think about the losses that occur as a person ages, so this can be the loss of loved ones. And in particular, we know that people who are single or people who are divorced or widowed more likely to commit suicide compared to people who are married or people who are in some kind of long-term relationship. Also think about the other losses that are going on here as well. So if you look here, we're looking at approximately retirement age. So if career is a really important part of your identity, then you're losing that too. You could also be losing things like maybe your independence, right? Or like the physical functions that you had before. So a lot of losses here for the individual person, and that can help us understand why this rate continues to climb as we move into older age. Okay, so this chart here looks even more specifically at both age and also demographic factors. So kind of combining the last two factors, and this is data from the CDC, or the Center for Disease Control, from a 2014 massive suicide study. And if you guys look here, you will see this particular group here. This is white males, okay, so this black line that continues to increase. And then if you look at comparing that with black men, right, and then also with our yellow here, white females, and we have virtually nothing for this group here, right, for Asian women. So just to kind of explain these demographic trends, right, so white men at very high risk for suicide, and in particular white men who are single, okay, so that's a really, really big suicide risk factor here. For Indian, okay, so think Native American, so we're looking here, right, pretty high suicide rate, but then it drops off. And part of the reason that this drops off so precipitously here is that we also see this high suicide rate within Native American men, typically coupled with high rates of substance use disorders, particularly with alcohol. So that's something to keep in mind here as well. So those are some of the risk factors, at least in terms of demographics. For the other groups that are featured on here, so for Black women and men and for Asian women and men, comparatively much lower, right? Much lower rates. And so some of the factors that might protect Asian women and men in particular is that kind of collective identity. So coming from a cultural background where your focus is on the group, and taking your own life is a very selfish act, right? It's focused on just me as the person. And so that kind of behavior would be deemed completely unacceptable within a society where your job is basically to maintain harmonious relationships within a group setting. So that's part of the reason that we see these very low rates for Asian women and men. For Black women and men, similarly, fairly low rates, at least in comparison to our other groups here. And part of what may insulate, especially strong for Black women, is a focus on religious identity. So many religions do not allow suicide, right? I mean, it's just not a solution. It's never a solution. And so their religious background might actually serve then as a protective factor as well. Okay, so some additional contributing factors here in terms of suicide. So we know that stress, and stress, as we have talked about in other classes so far, this is a big contributing factor, right? It's oftentimes a precipitating factor. The number of stressful events tends to increase prior to a suicide attempt. So very big factor here. Additionally, we also see some pretty commonly characteristic patterns of thinking. So for the person who is considering suicide, they often have a very high degree of hopelessness. So hopelessness meaning that things are never going to change. Things are never going to get better. And if I have that frame of mind, if I think, you know, things are never going to change, it's never going to get better, well, then maybe I go into seeing the only solution as suicide. And that's what we're talking about here with this dichotomous thinking. So a dichotomy is that it's either or, right? It's yes or no. There's nothing in between. So for the person who is considering suicide, it's I can commit suicide or not. That's the only solution. There's nothing in between. Okay, so they're seeing the world in these kind of very black and white terms, and then oftentimes, again, characterized by hopelessness. Additionally, substance use, so the use of alcohol and drugs, no surprises here that that is typically also involved in many suicide attempts. Okay, so there's also a particular model here that focuses on what's called a contagion of suicide. So think contagious, almost like it's contagion, like it's contagious. So the idea here is that when a suicide gets some kind of media coverage, when it becomes kind of glorified in the news media, that particular act can then serve as a model that other people who are thinking about suicide then want to imitate. So this act can basically serve as like a precipitating factor for other people then to also attempt suicide. So some of these triggers then are if someone close to you has attempted suicide, highly publicized ones, again, suicides that are very odd, right, or unusual, maybe very bizarre, and suicides that are getting a lot of attention within the media. Okay, so suicide in children and adolescents. This is kind of alarmingly increasing in some particular demographics. And this was a major study that came out 2 years ago by now, so 2015, from the CDC, the Center for Disease Control, that found that suicide is actually going up in certain age groups. And one of the age groups that seems to be increasing the most is with young children, and especially girls between the ages of 8 and 10. And so part of the reason that we've seen that rise in girls ages 8 to 10 could be a function of things like early puberty. So girls are going through puberty earlier and earlier, even though cognitively maybe they can't really handle that, right? I mean, think about an 8-year-old going through puberty. There's a lot, right, to deal with that's going on there. The other thing too is that girls who are early maturers, so girls who go through puberty earlier compared to their peers, oftentimes are the subject of ridicule, bullying, and things like that at school. So that gives us some insight into why we might be seeing those rises in that particular group. Additionally, suicide is relatively infrequent among children, but it is actually the third leading cause of death among children, which is very disturbing. Children also oftentimes choose kind of unusual methods. So things like running into traffic, right, and hoping to get hit by a car. That's a common method that children will use. So for children then, we see a spike after about age 14 compared to earlier ages. And this could possibly be explained by, possibly by the changes that accompany adolescence. So think puberty, think trying to fit in with your friends, trying to figure out your life. All of those things can be very stressful. And then no surprises here in terms of the clinical picture of teens who commit suicide, that oftentimes we see comorbid depression, we see low levels of self-esteem, and then also that characteristic of hopelessness, that things are never going to change, things are never going to get better. Okay, so this is a current issue within the mental health community, came about from some research in the 1990s where psychiatrists were prescribing antidepressant drugs for adolescents. So adolescents who had depression would be prescribed antidepressants, and they actually found that in some cases that for adolescents, instead of the antidepressants taking care of the depressive symptoms, they actually made them worse, which is concerning. So instead of taking care of the depressive symptoms, they actually increased what we call suicidal ideation, which is thinking about suicide. So some adolescents were actually thinking about suicide more after taking the drugs, and then were actually attempting and completing suicide as well. So now we have pretty strict warnings. They call it a black box warning. So if you look at a box of antidepressant drugs, you will see very, very clearly written that these can be potentially dangerous for people under the age of 18. So be very cautious in terms of prescriptions for antidepressant drugs with young people. Okay, so what are used then after a suicide attempt? So typically the first thing that you will see is that following a suicide attempt, we're going to need some kind of medical treatment depending on the method that was used. And then in addition to that, we're also going to add in psychotherapy. So we are typically going to add in extensive counseling, extensive treatment in that capacity. And oftentimes you guys will see that both cognitive and cognitive behavioral treatments work very well here. So the cognitive piece makes sense, right? Especially if we know that thinking is very much involved in suicide. So we want to address those thoughts of hopelessness. We want to address that dichotomous thinking so that we can potentially maybe give you different tools to deal with this the next time that you have these particular kinds of thoughts. So suicide prevention then, this is a relatively new public health push, and these are just some general things that characterize all suicide prevention programs. There are some specific approaches that your book outlines in a little bit more detail, but generally speaking with suicide prevention, we're looking at either kind of general programs that focus on preventing suicide, or we can also look at what are called like suicide hotlines. There's also currently like crisis text lines, so you can text as well if you're considering suicide. So the goal then in these suicide prevention programs is to establish a positive relationship between the prevention specialist and the person who is considering suicide, trying to really understand the issue from the perspective of the person who's considering suicide. And then also you as the prevention specialist want to try to figure out how likely is it that this person can actually commit suicide. So what's the potential here, right, that this person will actually go through with this? And then does the person have the means to make this happen? So if I'm talking to someone on the phone and this person tells me I'm considering suicide and I have a gun, and I've been drinking, and I'm here all alone in my house. Well, red flags should go off here, right? I mean, that is very dangerous. That is a recipe for a successful suicide. And so we want to make sure that we are then really attending to this person and doing all that we can do, because it's pretty likely that this person is going to attempt suicide. And then if we can get them to, kind of think about not committing suicide, let's talk about getting a plan together. So what are we going to do instead? And how are we going to, keep you from thinking that suicide is the option? Okay, and so then do these programs actually work? So in some cases they do, yeah, they definitely seem to work. But the caveat here is that for people who call, so people have to actually take advantage of the resource for it to be able to work. And it's difficult to measure how successful these things really are, because oftentimes there's not a lot of like long-term follow-up. So maybe we have mitigated a crisis here and now, but maybe we're not following up with this person 2 years later to see, is this person still alive? What's this person's mental health status? Additionally, too, many theorists have argued that instead of focusing on kind of intervening with the crisis, perhaps we should just have more effective prevention programs to begin with. So focusing on the risk factors that we know are involved in suicide, and then addressing those, as opposed to waiting until these things become an entrenched problem and then trying to address it from there.